That's what people think about me and impression that we have. But honestly, first of all, I'd like to thank the panelists who are here. Uh, it really means a lot because some of these people have. I have Mr. Sojwal Vora who's traveled specifically from Bangalore to be here today. There's an air show which is going on, and it was tough for him to get a flight, but still he made it here. Upasana ji was in Kumbh until this morning. She flew back just for this conference. She was otherwise scheduled to come back in the evening today, and she became unwell. She's just taken off her cannula before coming here. That's how privileged we are to have all of these speakers here. We have, Blue Star, who's agreed to be with us to showcase the importance of the role that they play, which is usually not seen by most people. Representation by Fuji, it's classic to see someone who represents a company where the name used to be usually associated with photos, pictures, camera, and today nobody knew that there's a role that they're playing in the hospitals and the healthcare ecosystem. So thank you so much for being here. The topic that we've chosen today for this conversation is sustainability. Sustainability is not just from the environment perspective. Sustainability also is the sustainability of an institution and the difference it could make to people who are otherwise coming to an institution where they are coming not by choice, but because they are unwell. So it is our duty to not just take care of the problem that they're coming up with, but to give a holistic healthcare delivery to them, and taking care of the environment that they are in is a duty of every healthcare institution. Mr. Sojwal Vora, I would want you to set the context for this discussion today. Let's begin with you sharing with us that how are we or are driving sustainability in the healthcare setup. What is it that you believe you are doing to create an impact in the healthcare system?
Yeah, thank you for having me here. And sometimes it's tough to be on a panel when it's right after lunch, but then I think we hope we don't make you sleep for sure. So coming back to the question, I think sustainability in healthcare, in the entire the healthcare spectrum, I would say, is not just about doing something that's sustainable while in the operating side of healthcare, in the hospital, in the pharma industry, wherever. It's also about designing in sustainable solutions, be it in construction materials being used, being it the type of materials that you purchase, being it the components that are used in the materials being purchased. There are multiple areas that are there. So designing in is also an important factor, because once you design in, it's easier to implement it. The designing in can also be in products that are used towards healthcare, of a patient. It could be, we were having an offline conversation. You mentioned about needles that painless and stuff like that, right? So someone in an R&D setup thought about designing in something that would help make it painless, make it efficient, make it useful for a reuse. That's also a part of sustainability, so I think that's where it comes from. Overall, I think it's about energy efficiency that everyone knows about. It's about protecting the environment that everyone knows about, but also designing in sustainability with materials that will last longer, with materials that have been actually, purchased from areas which are not a no-go from those regions, like so in Congo and stuff like that, right? So I think those are things that make sustainability important, and in a healthcare setup, obviously, the end result has to make sense for the patient. So I think that's what my starting remarks.
So apart from making sense for the patient, I think that anything that an institution does or spends money on also has to make financial sense for the organization. I mean, I was having a conversation with Dr. Manipal and he was talking about what's the point of putting in a machinery by spending a couple of crores and you don't have enough cases to be done there. So how do you, because you're passionate about sustainability, you also are a master of procurement that we've seen. How does it impact the organization in terms of the money that they spend on trying to be sustainable?
Right. So at the end of the day, there are CFOs who are there in every organization, and they look at value for money, return on investment. The point I would make here is that ROI may not always be in a financial point of view. The ROI may be a higher visibility for your organization through doing something that is a trending topic that that helps humanity. Though ROI may be on something that you are doing to advanced technology, which may not always give you a return in the short term. In the longer term, there is always, so there has to be an optimal balance, I would say, in terms of really looking at short-term financial metrics being improved versus longer-term. Does it help the organization is there a value that's coming out of activities that we are doing that may benefit us in an intangible way? Is what I would look for. Many times robotics, we talk of robotics, we talk of AI. That's what you started off this morning, the sessions, right? Not all robotics, not all AI. There are SaaS companies, so many of them who offer AI solutions. Not all of them may make complete business sense to be onboarded today itself. But then, we have to look at being, I would say, from a longer term standpoint, having an ROI that may not always be visible in a P&L.
Got it. Mr. Srinivasan, I mean, we know for a fact that there's a visible depletion in the ozone layer, which we don't experience, but we are experiencing it through the climate change. And we're seeing that in north part of India as well. And everything that we do in terms of air conditioning, chillers, etc., is a energy guzzler in an institution. So what are the decarbonization strategies that you follow that can help us reduce the carbon footprint? I mean, it's a cool term that everybody is using today, and make a healthcare segment more sustainable to actually put on ground as a practice.
Good afternoon and greetings to everyone. And it's indeed a pleasure to be part of this panelist. When it comes to decarbonization, so being the industry for almost 8 decades as a leading heating, ventilation and air conditioning and commercial refrigeration product manufacturer, we know the science of air conditioning much better than anyone in this industry. So having said that, the decarbonization strategy, there is no one solution fits for all the applications. So when it comes to healthcare, we need to look at each project as a unique, because it brings a lot of challenges for us. So what we normally look at is, when we propose any system or product for that matter, we propose total life cycle cost solutions. It is not only on the ROI. We talk about total life cycle cost saving. So the first cost, operating cost, okay, and at the end of the day, what product we propose, what is the sense it makes to the project. And apart from this, as I said, being one of the leading manufacturer in this industry, we started in 2000. We introduced the first scroll technology in the Indian as well as the global market. So what is the advantages? So this product brings almost 10 to 15% extra energy efficiency compared to the reciprocating type of compressors, which we are relying on this, all the equipments. And then later on, we introduced screw technology with flooded evaporators and falling film evaporators, which again gives huge saving on the equipments. And later, we are the first one to introduce oil-free centrifugal chillers in the Indian market. So when we talk about oil-free, people will think, what is that, oil-free? So this is one of the innovative solutions we introduced in the chiller technology, which consumes less than 2 amps starting current. Even you split AC in the residence, it takes more starting current. And is one of the best efficiency which we can provide from the Blue Star. Third is, it does not use any oil in the refrigeration circuit. That means, in the life cycle of the equipments, the efficiency, whatever we are confirming, it is there through the life cycle. So these are some of the things Blue Star is doing it, and we are continuously evolving and introducing new products and new technology in the market.
Yeah. Thank you, Mr. Sibal. When we talk about healthcare today, we are talking of technology advancements that are happening, and in the forefront of technology advancements is digitization at the base level. We see it everywhere. How is digitization in healthcare impacting and building on the sustainability of an healthcare institutions?
Yeah, so as you understand that digitization, without, we have a saying in our Fujifilm, either digitize or die. So you have no option. So if you want to die, you die.
Correct.
Or digitize yourself.
Right.
So nowadays also healthcare is going to be digitized actually everywhere. So we are digitizing, and Manipal is the best example. We have all digitized their 28 hospitals, connected all of them. Anywhere the patient is there in any hospital, they can see their images, they can be teleradiology kind of services can be given. And National Digital Health Mission is giving a lot of impetus to this. Now, every healthcare professional, whether it is a dentist, whether it is any kind of a clinic, small diagnostic center, has to has that kind of a systems which will put your images on the net, and those images can be compared. And once you have the data, you can do a lot of things. You can see with that data, government can see with the data which disease is prevalent at which state, which kind of cancers are happening in which areas, and what can be the root cause of that, because of the water problem, air pollution, this, that. So a lot of things can be done once the digital data is there with us. And that is going to be the backbone of our technology solutions. AIs will be put on those technology only. If digitization is not there, the basic is not there, nothing can be done. So we are also making our PACS risk systems in India now, which will be much cheaper, because the other systems which they have bought is very costly. They have bought from US and other countries. But definitely now we are making from our own Indian this thing, and those will be much cheaper for the small diagnostic centers to the very, very small clinician can take it.
Sir, वो complain कर रहे हैं. Upasana ji, I remember when we were talking about the design of hospital, I spoke with Sanjeev Singh ji on how he came up with the design that solves the problem of healthcare delivery, keeping in mind the challenge in terms of the skill set not available, the human resource issues. Similarly, when we are talking of sustainability in the north of India, yours is the biggest, newest hospital that is coming up in this area. बहुत बड़ी बड़ी बातें होती हैं, सब जगह हम बातें कर रहे होते हैं, but we realize the problem only when we know the magnanimity of the issues that is there, and which is why digitization is actually helping us understand how big the issue is. When you are making this new hospital, what are the things that you have kept in mind at the ground level that is ensuring your effort towards sustainability and resilient towards issues that are otherwise a very big challenge for another hospital which already exists, which was built probably decades ago?
Thank you, Harbinder ji. First of all, I am very happy that today I am sitting with two people who are already, I am working with Blue Star and Fujifilm. So, when we thought about new hospital, because my existing hospital is also green hospital, but there were limitation because it was already a built hospital, so it was not a green field. So we did lots of changes to make it green, because I believe as a healthcare provider, we are generating lots of biomedical waste as well as lots of gases which is not good for environment, and all hospitals all the time using AC. So it was very important that we should make a hospital which is a green hospital, and my hospital is going to be first hospital in North India which is a LEED certified hospital platinum level. So for that what we have done, we have used special glasses which are observing heat, and they are not sending heat from outside to inside. And all hospital, if you take a round, everywhere you will find lights, sunlight. So you need not to use all the time all these kind of lights. So energy saving, and same time I am using different kind of products, like I have used this Bailey Med CSSD, which is using only 10 liters of water in one cycle. If I go with another company like Getenge and others, these CSSDs are consuming 300 liter waters. So to reduce water consumption, I chosen this Same time, that is why I have chosen this Blue Star also, because they are coming up with new technology, and Fuji with new technology like digitization, as well as we have made 10 hospitals under one hospital. So like for every department there is a lift. So you can go there and everything will be there for yourself. So unnecessary use of lift should not be there. So in this manner also, and we are using lots of solar energy. Same time after COVID, we have, came to know about that any time, any kind of, infection can come. And that time, because last time it was very difficult for the hospitals to control spreading through ACs. So now we have learned this, so this hospital we have made accordingly. So one area which is, we can, cordon off from other area. So if there is any disaster, I use disaster word for such kind of pandemic. So we can at least save other patients who are not infected by that disease. So this was in our mind, and that is how we have chosen the best things, and whatever latest available in the market, we have chosen that.
Fantastic. I mean, it's something which is commendable. Mr. Vora, I'm asking you this question specifically because you also come from a procurement background. When somebody has a choice they have to make to procure something in a hospital, there are different things that come into your mind. The requirement, the basic need that that particular product or a service is going to serve, at what cost, how easy is it to align it with what exists already, and then now we are talking of sustainability. Where does sustainability come in this series of thoughts while making a mindful decision in procurement, and how can we create it as a culture to be conscious towards sustainability when taking any executive decision in a healthcare environment?
Thank you for asking that question. I think sustainability comes in when you look at the total cost of ownership over the life cycle of the product or the service that you're buying. Right? When you look at a one-time, purchase decision, okay, I'm buying this product, this is, X% lower than the other competition, and then you don't realize what are you going to pay for that product over a life cycle of the product, be it the servicing of that product, be it the associated costs that you need to run that product, like she talked about energy efficient, lighting, for example, skylight, available where we can, water conservation, all these are efforts. So these need to come into play, choosing material that may sound, choosing equipment that may sound expensive initially, but over the life cycle they will pay out for themselves, because they are consuming far lesser consumables over a period of time. Is something that we look at. So whenever we make a procurement decision, given that we are a very large network with 40 plus locations across the country, and we need to have common processes, common systems across. Sometimes it becomes easier to take those decisions when we look at the entire life cycle of the product. We typically look at anywhere between 7 to 12 years, depending on what product it is. Some of the examples that he talked of, the Fuji pack, the digitization effort that we did. No hospital changes packs in 10, 12, 15 years. So there I looked at a 20-year life cycle. What would it be for me to take? So while the initial cost seemed very high, but then when I look at the amount of money we will save over 20 years by not having a patient print, reports and go whenever they are traveling, or by, not using those, X-ray films that are traditionally being used, right? So when you look at all of those elements, the costs start paying out for themselves. So I think the TCO is what I would say is an important element in this. And she talked of LEED certification. It's really nice to see that happening also in this part of the world, because LEED certification platinum level is really a good thing. It's not easy to get to platinum level, because you need to start right from the soil itself. It's not even about which builder you're using, what materials they're using, the soil that's being excavated, what is it going to be used for? Is that going to be disposed of in an environmental friendly way? That's where platinum certification comes in, especially in the C&I category. We have 2 hospitals that we have. The first one is 10 years old, the third one in the country, which was platinum LEED certified, 2015 that we launched it. Another one that came in 2017. But since then, some of the new projects that we've been having, we can't really control the soil, that because we come into play much later. It's a part of a very large project, that the builder is doing. It's a commercial establishment. One element of it is a hospital, So somewhere, I think the entire ecosystem has to start planning towards a LEED certification. At a minimum, gold is what people should be aspiring for. Platinum is really, it's nice to hear that we are going for platinum. But sometimes people find it difficult to even go for bronze, let alone silver or gold or platinum. So I think that's where it comes from, eventually.
Awesome. Mr. Sibal, when we are looking at equipment that a hospital buys, today the technology is changing so fast, it's very difficult for a hospital to even recover the cost for that equipment before the new equipment comes in. And also for the benefit of sustainability, there's this concept of reuse and recycle that needs to be given more importance than it already has been. And today technology has advanced to a point where we may not need to change the hardware, but the software could change. How are companies like yours looking at this from the perspective so that it creates a good business model for the hospital, yet it takes care of environmental benefits and makes a business sense?
Yeah, correct. I think this is a very relevant question. And when I was talking to Vora Saab before the meeting, actually I was telling him, he has not made a decision based on the 5-year total cost of ownership, actually TCO. He has made it over the 20 years. And nobody looks, उसको लगता है कि यार 5 साल के बाद तो कोई और आ जाएगा यार. तो इन्होंने वो, क्योंकि हमने इनको एक कंडीशन दिया था कि कोई भी अपग्रेड आता है इसमें, any kind of upgrade we will give as a part of AMC or CMC. So that they liked over the competition. और हमने कहा था कि 20 साल क्या 100 साल तक आप इसको चलाइए हमारे प्रोडक्ट, और जब तक आप चलाते जाएंगे, जब तक आप AMC और CMC हमको देते रहेंगे, हम इसको पूरा अपग्रेड करके देते रहेंगे. एंड आई थिंक दैट set the chord with sir, and he has taken our equipment and he has taken our thing. So basically the life cycle is very important. If suppose equipment works for 10 years and it works for 15 years, it makes a lot of sense, and even more than 15 years. Some of the equipments which I have seen are working for 20-25 years. MRs, which are permanent magnets actually, they have very less power consumption of 10 kVA power only, and they are working for 25-30 years, and it has a life of, because it's a permanent MR, it has a life of 100 years. So, and if we keep on upgrading the softwares and the associated accessories like the coils, etc., and the electronics, keep on working on the same things. So that upgradation is a part of our manufacturing, designing of those equipments.
Got it. Mr. Srinivasan, we were talking about emissions. And apart from the ACs, there are chillers being used in the hospitals, and I think that's one of the widest product being used in the Indian healthcare ecosystem. Now, what is Blue Star's focus when it comes to emissions of refrigerants that are being used? And because these are actually creating an impact on global warming. I mean, even when as a consumer, what we see the number of ACs being put, uski heat bahar ja rahi hai. I mean, if you were to just look at the kind of heat that is being emitted. So emissions ka kya role hai, and what is it that Blue Star is doing about it?
From Blue Star strategy, as I said, we are the one of the innovative and leading manufacturer. So we are the first one to introduce again in the Indian market the energy efficient and eco-friendly refrigerant. We started with R410A, the refrigerant. So earlier we used to have R22 refrigerant, which has got both ODP and GWP. So ODP stands for ozone depletion potential. GWP stands for global warming potential. So we introduced the R410A based refrigerant in our Blue Star variable refrigerant flow systems. And also in the chillers for commercial products, we introduced R134A refrigerant, which has got zero ODP in both R410A and R134A. So GWP is less than 2000 in terms of numbers. And if you see the Europe is leading the reducing the global warming potential. So there is a ratifications was signed in Kigali. Okay. So I think Indian government also has signed. So as part of this, so entire industry, the air conditioning industry, moving towards zero GWP or zero ODP, so to protect the environment. So for Indian market, we are also venturing a lot of options to go for which kind of refrigerant it will be suitable for our industry in terms of cost, in terms of manufacturing. So we are looking at multiple options. So currently we have R410A and R134A. So we are also looking at many options to reduce the emissions in the environment. Not only that, see, this is the second stage. The first stage, as everyone said, we need to try to reduce the energy consumption in the facilities. How we can do that? Go for passive cooling. Okay, reduce the air conditioning requirements by going for radiant cooling in some of the facilities. Use the geothermal energy because it's available here, and try to use that. So in which way, you're going towards renewable energy, solar. So ma'am said, so they're using the solar powered for the entire facility. So not only that, you can also use solar panels for hot water production. And then heat pumps is our talk of the town. People are using heat pumps to produce hot water, which can produce, hot water up to 75, 80 degree. So this means you can reduce the fossil fuels. You can reduce the, emissions. So there are many ways, we can do this. So Blues are also, into manufacturing the heat pumps. We started with the manufacturing heat pumps for the residential and light commercial applications. So we are there.
Got it. Upasana ji, my next question, in fact, the last question for this panel is to you. Everybody is providing services, but you are the consumer when it comes to services related to sustainability. The two things that come to my mind as a hospital is, one is radiation, and second is waste. And the waste is not just the waste that we understand, it is a waste of a very peculiar nature. There's human waste coming out of an OT, etc. And there are few companies which are very specialized in handling that. What is the role of a hospital in one, designing and managing the institution in a way that you can control the radiation, especially when you're building a new institution? Second is, waste management ke liye, what are your suggestions? Because as a user, you can either comply with what somebody is selling to you, or you can come up with things that, listen, why can't we do this? So ye ek partnership in terms of finding innovation in solving a problem which is an environment real problem, how can it be made better?
So for radiation, there are norms from AERB and we have to follow. And everybody, I think, whosoever is making big hospital has to follow, and they are following it. So one part of this that we are supposed to follow, and we are already following all those norms, which is not only for Linux, rather for X-ray and all. Because we could not install our X-ray, which Sekhar has delivered to us, because unless we will get a clearance from AERB. But I would like to talk about this, waste. It is very important that all hospitals should keep an eye on their waste, because what is happening, if you are not following biomedical waste norms, then generally staff is mixing your biomedical waste with general waste, and that waste can create problems for the society. So that is how, like NABH told us that how to segregate all the waste in different categories, in different color codings. But generally everybody is giving this training to the housekeeping staff, which is not necessary that only he is generating waste or he is supposed to take care of. So what we do, all the consultants are very much aware where, in which color they are supposed to throw their needles and other things. Same time, nurses, in every bed we are providing 3 color coding dustbins. So we should not generate more biomedical waste. General waste has to be segregated from this. And as a hospital or any provider of healthcare, we need to see that facility also. Who is taking your waste? Are they following all the norms? So there are few things as a Jagruk Nagrik you have to go. So I myself go to that place to whom I am associated with for my biomedical waste. So I visited that place, and when I saw that they are following all the norms, after that I have signed the MOU with them.
Fantastic. Yeah, please.
just wanted to have one last comment. The effort towards sustainability from an organization standpoint, the one of the pitfalls that you need to avoid is to what I would call as greenwashing. Like whitewashing hota hai वैसे. You to appear to be doing things sustainably, you do stuff. Which is short term in nature. Greenwashing, right? For example, you may have you may create an environmental, guidelines or a policy, an ESG policy to show to to SEBI or to show to investors. But if you don't really follow it in the true spirit of what you have documented, that's greenwashing. If you, there are examples, even procurement of, as an example, switches, I will say, switches, sockets that every company has, when we try to ask for environmental friendly or green products, they say, okay, by the way, this is the product line we have. Oh, but this product line is you merely used paint on it, which is, let's say, antimicrobial, or stuff like that. After a few years of use, the paint is going to go away, and then you're going to again. It's a commonly used item. Right? Switches in every hospital room, you need them. Infections are there in every hospital room. So now we go for copper impregnated, for example, in the resin itself when the switches are molded, and the products are available nowadays. So going for those elements which are really longer term sustainable, which prevent the perception of greenwashing is important to have. Vinyl flooring, every hospital needs vinyl flooring. Not every vinyl flooring is really long lasting. It's so many elements that go into even the construction of a hospital, the way it's designed is important.
Absolutely, I think that's a brilliant point, because what happens is, if procurement does not understand what they are buying and whether it is actually something which is green or just being presented as green, it makes a difference. And I think, the underlying thing is that what came out from what Upasana ji was saying, that, most of us know that we need to work towards sustainability, but what does sustainability mean? Many of us are not even educated on it. The decision makers, they are hiring teams, but they themselves don't know what it could mean to the organization. Second is people who are cleaning, the people at the ground level, उनको बताया जाता है कि ये चीज़ करनी है, बट क्यों करनी है, इसका इम्पैक्ट क्या होगा, उनको नहीं पता. इट्स लाइक टेलिंग द पर्सन ऑन द रिसेप्शन दैट यू नीड टू हैव अ स्माइलिंग फेस विदाउट लेटिंग देम नो दैट व्हाट कैन दैट स्माइल डू एंड व्हाट डज इट मीन टू द पेशेंट और टू द इंस्टीट्यूशन. So with that, I'd like to end, but Upasana ji, you have something to say.
Can I just
Absolutely,
2 minutes?
ma'am.
We were talking about that how we can make a place which can, sustainability and all. So when I made my emergency, I tried to keep all radiology things there and ICU also there. So, not only for me, for patient also it is going to be very beneficial. When he entered in emergency, all his tests can be done then and there. And if he is that much sick, he can go to ICU, which is there only, 15-bedded ICU. So, I mean to say we are, saving our energy. We are not sending patient every time to the lift. And same time we are saving our patient's life, which is more important to everyone. So we should see everything in a, Doordarshita se. And then we should go for any construction work.
Absolutely. I think that's the thing. We must look at the benefit that it is to us, to our customer, and as a responsibility to our business and to the environment. With that, I'd like to close the panel. I have lived up to my reputation of taking 5 minutes more than what I do. So thank you so much for allowing me to do that. Thank you.